great questions. So, boy, there's so much advice I give somebody new in recovery. Patience, grasshopper. You know, like as you know, we come into treatment usually because of some type of external consequence that creates pain. It's interfering with the way that we would prefer to live. So we come into treatment because of pain. And as you know, especially in the residential care, it's within the first week, you know, this innate need to go fix everything. And it's not about that. You know, it's about being patient and trusting in a process. And that process means that you're not always going to do what you want to do. You have to do what you need to do. And so therefore, the importance of being patient and following directions, even if you want to go into a different direction, to me is so critically important for the new person in recovery. For the new person in the field, to me, I think I would probably take more of a harsher approach. I can remember when I was in graduate school many years ago, and they were talking about drug and alcohol counseling, and they said, you know, the average burnout rate is 4 to 6 years. And to me, I have seen people come and go in this field. And the people that make an impact, the people that stay into the field, the people that are dedicated to the field, are people that truly view this as a calling. You know, it is not a job. It's a calling. Now, some people get called because of their own, you know, story of recovery, which I think is beautiful. But not everybody who works in this field is in recovery. You know, you can still have that calling. So, to me, if this is what you want to do, I would say, you know, you really need to assess: is this a true calling? Is this something you're really passionate about? You know, because you have a great deal of responsibility. You know, you are in charge of guiding someone who needs guidance, and that cannot be taken lightly. It's not a joke. Our patients don't deserve a therapist that's just here because of a paycheck. They deserve a therapist who is truly passionate, even in the difficult times, right? As you and I both know, you have those patients that are just so difficult to work with. And we were talking earlier about how rewarding it is when a light bulb goes off. But it could be equally rewarding when you're dealing with the most resistant, difficult patient, when you have that moment. It could just be brief, that brief moment of surrender where you both agree and you see something. And that could be just as beautiful as the spark that goes off whenever both of you are positively impacted. So to me, for a new person in the field, really assess, is this something you're passionate about doing? Because the product that we deal with, the patients, deserve much more than just somebody looking to get a paycheck.
I couldn't agree more, and I think that passion shows itself through that genuineness that you talked about in the beginning.
That's right.
So,
you know,
George, thank you so much for sharing with us today. You know,
great.
I can't wait to have you back. I can't wait to continue to pick your brain, because this is a part of the learning process for all of us. So thank you for your time today.
Yeah, great. Thank you.
We'll see you again soon.
Definitely, anytime.
Thank you,
Thanks.
George.
Yep.